Patients typically seek an abdominoplasty or tummy tuck because of concerns about excess abdominal skin, especially after pregnancy or significant weight loss. Patients also seek to correct diastasis or laxity of the abdominal muscles, which can often occur with pregnancy. Abdominoplasty is done under general anesthetic and is typically an outpatient surgery that takes approximately 2 hours in the operating room. This procedure is done through a low horizontal abdominal incision. The more skin the patient has, the longer the incision typically is. The skin is lifted away from the abdominal muscles, replaced in a taut manner, and excess skin is removed. The abdominal muscles are tightened at the same time with permanent sutures in multiple layers. A small scar is often necessary around the umbilicus or belly button. Often, a tummy tuck is done as a combined procedure, such as a mommy makeover, with a breast augmentation or breast lift, as well as liposuction of the hips and thighs. Most patients will have a drain that stays in as long as a week, and the sutures are absorbable. Postoperative pain control is achieved with medications and muscle relaxants, and pain pumps may be used. Most patients can return to work at approximately 2 to 3 weeks, and full activity is typically resumed at 6 to 8 weeks after your procedure. While abdominoplasty often requires a more intense recovery early on, the long-term patient satisfaction rates for the procedure are very high, with beautiful, long-lasting results. It is not to be confused with a weight loss procedure. However, most patients are very pleased with the resulting contouring and tightening of the abdominal wall. If you are considering a tummy tuck, simply contact us to schedule a no-obligation consultation to discuss your personal situation and goals. We are committed to listening to our patients to help them achieve their desired outcome and are here to help you do the same.